Hi everyone. I know everyone's super concerned about the coronavirus, so I thought I'd make a little video so everyone can understand what it's all about and what is really going on. COVID-19 is a type of coronavirus. There's at least 6 types of coronavirus that affect humans. If you remember, SARS was one of them that had occurred previously, and now we have the COVID-19, and this one's labeled 19 because it was identified in 2019. So I want to go give you a little background about viruses in general. How do viruses work? Basically, a virus enters the body through the nose, mouth, and eyes. And in the case of COVID-19, it goes into the lung and primarily affects the cells in the lung. Once it enters the body, it attaches to our cells. And the way it does that is through something called the ACE2 receptor. It's a receptor on the surface of our cells. Many ACE inhibitors work through that receptor. Also, ibuprofen works via that receptor. People that take ACE inhibitors and take ibuprofen increase the number of receptors on their cells, so they become more susceptible to the virus. So if you're taking ibuprofen, try to switch to something else. That'll probably be a little bit of a protective effect for you. Once the virus gets into the cell, it releases its genetic material, and it hijacks the cell's machinery and starts making copies of its own genetic material instead of the machinery making the cell's products. Once the genetic material is duplicated, it forms new viruses, and then the cell ruptures, releasing those viruses that can go on to infect other cells. Once you're infected with the virus is released from the body through coughing and sneezing, and then other people breathe it in through droplets within the air. Many people are concerned and they want to take antibiotics. Well, let me assure you, antibiotics only work on bacteria, and viruses are completely different. Taking antibiotics won't have any impact on your defense against viruses. The only thing you can do is take antivirals. There's antivirals out there for other things, for example, HIV, SARS, and so forth. But there's no specific antiviral currently available for COVID-19. So what can you do now? Well, you can take zinc and vitamin C. Vitamin C helps to boost your immune system, and zinc specifically prevents the virus from being able to hijack the cell's machinery. So zinc can prevent that. Zinc has been available as an antiviral supplement. Things like Cold-EEZE, Zicam, all these things take advantage of zinc to try to protect the body against viruses, and that can work pretty well. People always also ask about masks. Do masks work? Well, not all masks work. Regular masks aren't really that effective. N95 masks that you've all heard a lot about definitely do work, but they have to be fit tested to make sure you're fitted for it properly. Just wearing the mask usually won't be effective because there's areas of leakage around the mask that can allow the virus to enter from surrounding environment through the edge of the mask. Some examples of people that can have trouble with masks is going to be people with beards. The mask isn't going to be effective in someone who has a beard. If you have a super large nose, it's definitely not going to be effective, and we can certainly help you with that, but not until this scare is over. So once you're fit tested, the mask does work, but if you're in a virus-rich environment where there's a lot of virus and droplets in the air, it accumulates on the outside of the mask, and you soon have to throw that mask out and wear a new mask, otherwise it's not effective. So theoretically, you should wear a new mask every day. Currently, there's a big shortage of personal protective equipment, which is what you're going to hear, PPE. There's not enough even to go around to the healthcare providers that are trying to provide care for the people that have the COVID-19 virus. So the best thing you can do right now is take the supplements, as we discussed, zinc and vitamin C, and also try to stay as far away from people as possible. Keep in mind, this virus has been in this country probably since December, and many of us have already been exposed. And if you see the numbers are going up, it's only because more testing is taking place, not because it's starting to affect us more severely. The goal of the healthcare system now is to reduce the transmission rate so that the healthcare system can accommodate the number of patients that are going to require critical care support and ventilators. What are you going to do if you feel like you may be infected? Well, keep in mind this virus primarily affects the respiratory system. So if you're having a cough, if you're having fever, then you definitely need to call your healthcare provider and you can get tested and see if you're affected. Not enough tests out there right now, but they're working on getting more. Hopefully you won't be affected. Try to stay safe, and if you follow these guidelines, hopefully you won't have an issue. If you have any questions, don't hesitate to post them. We'll try to answer as many as we can. Thank you for watching. I hope this was helpful. If you liked the video, please like us, and you can also subscribe so you can get up-to-date information as it becomes available.